Hello, everybody. Hi, how are you doing? It's Yvette McQueen, MD, emergency physician and travel doctor, a global physician on a mission to educate about health, travel wellness, and disease prevention. So I'm coming to you Saturday, November, what's today? 16th? Yeah. And so it's 5 o'clock p.m. Eastern Standard Time, and this is the medical chat room with Dr. Yvette. I was looking for my earphones, so I'm traveling, but I still wanted to come to you. So I'm looking for my earphones so you can actually hear me better, because I'm actually broadcasting I stopped on the side. I'm broadcasting from somewhere else. So hopefully you can hear me, because I'm trying to block out the background noise where I'm at, but I can't find my earplugs so that you can actually get the full effect. But I still wanted to come to you while I was traveling. Once again, the medical chat room with Dr. Yvette. So today's topic, I'm gonna keep looking for those earplugs though. So today's topic is about diabetes. You've been diagnosed, now what? So last week we talked about diabetes and the different types. So there's type 1 that is insulin dependent. You need insulin, and it's usually due to autoimmune, and you're born with it. Where type 2 diabetics, which is the majority, the other 90% of the population, and 83 million Americans. Yes. So 33 million Americans are diagnosed with diabetes, and then the other 83 million don't even know they have it. So type 2 diabetes. Last week we talked about how you get diagnosed with diabetes, and the biggest one is your hemoglobin A1C. So your hemoglobin let me turn this up, make sure people can hear. Okay. So your hemoglobin A1C, if it's under 5.7 is normal. Between 5.7 and 6.4, you're pre-diabetic, and over 6.4, you are diagnosed with diabetes. And once you get diagnosed with diabetes, your doctor, or your nurse practitioner, whoever you see for your healthcare provider, will want you to be treated for it. Because, so if you have diabetes and your sugars are running higher than normal, and remember I said if you're not fasting and it's greater than 140 and definitely over 200, you're diabetic. If you come to my emergency room, I'm gonna put you on medicine. So if you are a diabetic and your sugars are steadily running high, 200s, 300s, that just beats up your body. It's beating up your other organs. So, steady high glucose in your bloodstream affects your blood vessels, and it beats up your blood vessels and hardens them and make them basically not functioning how they're supposed to. And the complications of uncontrolled diabetes will result in heart disease, heart attacks. It will result in kidney disease, kidney failure. You have to be on dialysis. It affects the small blood vessels that's like going to your toes and your fingers, where you don't get blood supply. You get wounds. You don't know you get wounds. And they fester, and that's how people end up having to have amputations. It affects your eyes. It affects the eyesight, blurry vision to blindness. And that's what uncontrolled diabetes will do. So that's why you want to keep it under control, because you can live a healthy life. You can live a productive life with diabetes. It's not a death sentence. People are like, oh no, I'm diagnosed with diabetes. What am I gonna do? You can live. You can live. And you can live and still eat and drink and eat. You just have to modify, and that's another subject. So you've been diagnosed with diabetes, and your doctor wants it under control. Okay, so type 1. And by type 1, I said insulin dependent, because your body does not make the insulin, or is not making the right amount of insulin. So with type 1, you have to be on insulin, whether you're on insulin where you give yourself the shots, or a lot of type 1s are now on what they call the insulin pump, and they get a steady dose of insulin throughout the day. It's monitored, it's placed, the insert, your arm, your abdomen, somewhere, and you get a steady amount of insulin throughout the day. Also, one of the great things, instead of always taking your blood sugar like on your fingertips, and you'll know diabetics have little dots and they'll check the fingertips. There's now an implantable. It goes right on your arm, and by Bluetooth it monitors your blood sugar. You just take a little handheld monitor and you put it up to it, and it'll check it without you having to constantly stick yourself. And it's a great tool, and it's a great way to monitor your blood sugar throughout the day, know if different things are causing your blood sugar to go up and down, different foods to go up and down. That way they can actually monitor the amount of insulin they can give you, because it's been shown that some people, blood sugar go down at night while they're sleeping, and then they can't sleep, they have fitful nights, they wake up, and the doctor knows to monitor their nighttime dose. Wonderful. So if you're type 1, definitely discuss with your healthcare provider and your insurance about having the glucose monitor that's implanted in you, so you're not sticking yourself all the time. So type 1, you do need insulin. Different type of insulins out there, whether you're dealing with the kind that you used to seeing with the needles and pulling up and injecting yourself with it, versus the prescribed pens. They have prescribed pens. There's short-acting insulin, and there's long-acting insulin. Do you take it once a day? Do you take it twice a day? Do you take it 3 times a day? And of course, if you're what we call brittle diabetics, or diabetics that go up and down, and we have problems controlling it, then you're a great candidate for the insulin pump, where you get the steady dose throughout the day. So you have the different, and they're like pre-filled syringes, where the insulin is in a syringe, and you just put the needle on it, and you give yourself the dose. And most insurance do cover those type of insulin. So type 2. If you're told you have type 2 diabetes, remember type 2 diabetes, once again, it's preventable and controllable. And of course, due to our lifestyle here in the U.S., a lot of it's due to our activity or exercise level and our diet. So we'll talk about that control. But if you're being diagnosed with type 2 diabetes, they will put you on. They'll do the diet control. Hopefully you get diabetic education, some nutritional education about how to change how you eat, what foods are good for you, the glycemic index. That's one of my topics for next week, about lifestyle and nutrition. They also put you on medicine. So by the American Diabetic Association and Endocrinology Association states that the first treatment for type 2 diabetics is metformin. It's a type of pill that you take that you can take it once a day or twice a day, and it reduces it actually helps the insulin push the glucose back into the cells. Remember, you're making insulin, but it's just not playing right in the sandbox. So it's helping the glucose to go back in the cell. So, there's other ones like glucophage, glyburide, but metformin is the first line of treatment. A lot of people do say it causes stomach upset, it causes nausea, and it will cause some diarrhea. But still give that a try first, for you to. They still give that a try first. And someone's calling me. Hopefully you can hear me. Maybe they were calling me and tell me that. They'll give that a try first. There's other medicines now out there that they give also that helps the pancreas to increase your insulin. There's medicine to help the insulin work more effectively on your glucose. And those will also be in syringe levels. And once again, the pre-filled syringe, you give yourself a certain amount of dose. You see all the ads, the TV ads about it. So, there's the once a day, there's a once a week that works effectively. Some of them are cardioprotective too. And then if those medicines aren't working, then your doctor may have to put you on insulin also. Once again, the long-acting versus the short-acting insulin. That's what it is. Your doctor, if your primary care doctor or your primary care provider does not feel comfortable in taking care of your diabetes, or they feel that it's kind of uncontrollable and they need more help, they will send you to an endocrinologist. An endocrinologist is a specialized doctor that deals with the chemicals and hormones in your body. That type of doctor deals with diabetes and hypertension and thyroid problems and adrenal problems, but they specialize in diabetes. So you may be referred to endocrinologists to handle your diabetes, which they do that every day, and they know what they're doing, and they even have some little tweaks other people don't have. So that can be a good thing. So once again, type 1 is controlled with insulin, and there's different gadgets out there, and type 2 can be controlled with the medications. It also is controlled by your activity level. You need to start increasing your activity level. And I don't say exercise, because I know some people don't like the word exercise or regimen exercise or routine, but you need to start increasing your activity level. That means activity every day, 30 minutes of walking every day, an hour 3 times a week. And you can do that in certain different ways of changing your lifestyle. You need to change the way we eat and drink, basically every day. But the biggest part is you need to know how you eat and drink, or what you eat and drink first. So I always say, I eat healthy. I'm good. I eat healthy. I eat healthy when it comes to like my regular meals, my lunch, my dinner. I didn't realize what I was doing in between, or those late nights in the emergency room. So what I want you to do is, if you listen to this or the recording, for the next week, between here and next Saturday, write down everything you eat and drink, even gum, candy. That makes a difference, because you don't know the little things you put in your mouth periodically. You're driving along and you go, oh, you start eating. So, and I'm not saying write the calories down, just write down what you eat and drink, so that you know when you drink things and when you eat things. Or, if you drink in the liter of soda instead of drinking water. Or and also your activity level. If you're walking, if you're running, if you're going up and down stairs, even the little activity around the house, chores, vacuuming, cleaning, gardening, makes a difference of your activity level, what you do. So you can either write it down. There's different apps out there on your smartphone. You can find out where they are. I'm not going to recommend anything because no one's endorsing me. So you can get different apps to write down how to keep your food intake and your activity intake, or just write it down on a piece of paper so you can see for the next week, so you can actually see. And then once you see what you're doing, you know where you can modify it, where you can change it. So I was looking up this book. All this information, of course, is available on different websites. You can always go to cdc.gov and put in diabetes, and it gives you a whole plan about diabetes. You can go to the American Diabetic Association. I think it's .org. American Diabetic Association. Just Google it. You can go in there. Oh, come on. It won't come up. You're too close. Okay. One. And then the other one is a book I wanted to recommend, and I'll actually put it in the comments. Let's see if I can pull it up here. The book is a friend of mine wrote, it's about diabetes. It's like, now you've been diagnosed with diabetes, now what to do. So I'm gonna put that in the comments so you can always come back and check that out and see. Let's see. Nope. Can't find it here, right? So the exact title, but I'll put it in the comments. And this past Wednesday, November 13th, was actually Kindness Day. So I just want to finish this off of, you should be kind to yourself. We're kind to others, but remember to be kind to yourself, and be kind to take care of yourself. Take care of yourself, take care of your loved ones. So even if you haven't been diagnosed with diabetes and you have a family member that's been diabetes, be kind and get this information to them and make sure they're managing their diabetes, because it does result in eye blindness and heart disease, stroke, limb amputation, kidney disease, kidney failure where you're on dialysis. And it's all about the control of the diabetes and keeping that glucose under check. And so once again, there's great things out there, the monitor system that you can have implanted, the insulin pump, the different type of medicines, whether it's the pill form or the insulin form or the syringe form. It's pre-filled syringes, literally. The pharmacy hands it to you, you screw in a little needle, you put alcohol on your body, you turn the dial to whatever your dosage is that the doctor told you, and you go boom, and you're done, whether it's daily or weekly. And if you're on the go person, weekly works wonderful, because then you remember it. You pick your Saturday, you pick your Sunday, whatever day you pick, and you can remember it. So that's what I want to talk about today. You've been diagnosed with diabetes. Now what? But you can live a healthy and productive life with diabetes and changing it. Next week, I want to talk about lifestyle modifications and nutrition. So between here today and next week, you're going to write down everything you're eating and everything you're drinking and your activity levels, so that you know what you're doing and what you're putting in your mouth, so you can modify it. And next week, we'll talk about nutrition for diabetics, about glycemic index. They talk about simple versus complex carbohydrates. We're going to talk about, dining out, how to effectively choose a good menu. And we're going to talk about just going to the grocery store and what's going to be on your grocery list for Thanksgiving. So that, it can be heart healthy, diabetic healthy for you and your family. So that's what we're going to talk about next week. And once again, on Saturday, I'm here in Medical Chat Room with Dr. Yvette. Come back. I'm going to post, once again, more information can be in cdc.gov for diabetics, American Diabetic Association. I'm going to post the name of the book that I recommend for if you've been newly diagnosed, that you need to check it out, okay? So I hope this information has been helpful for you, your family members, loved ones, friends, whoever it can be. And join me next Saturday at 5 o'clock p.m. Eastern Standard Time. Once again, Medical Chat Room with Dr. Yvette. November is Diabetic Awareness Month. And once again, I am your global physician on a mission to educate about health, travel, wellness, and disease prevention. Find me at YvetteMcQueen.com and all social media at Yvette McQueen MD, YvetteMcQueenMD.com, and all social media Yvette McQueen MD. So ciao for now, and I'm going to keep journeying on my way up the highway, okay? Peace out.